It is easy to derive where the location is, fine. Is easy to derive what are you as a patient, you ask them क्या लगता है, कैसा होता है, पेन कैसा होता है, कभी सुबह दोपहर शाम, time or the circumstances modality, that when it is worse, when it is less, that is when it is physical. It may be mental also. If suppose if you are disappointed, if you are sad, what makes you more sad, वगैरह सब बोल सकते हैं patients को. So yeah. So what we take a small the how to take history, very simple. What was taught in college was fantastic. So in that you take up first 4 things. Then next decoding, that is the philosophy will do that. This is the first basic history. Agreed? LSMC. Very simple. Everybody, even just now who has passed out, you can ask them for ye malum hai. They know what is that. First one is location, wherever it is, mind, body, tissues, organ, system. If it is fever, general fever, you can take it. Sensation is it. उसमें क्या क्या होता है, how they go through, and what is that sudden pain, slow growing pain, like that. Modality, that is disease modifying factors, aggravation or amelioration. The last one is concomitant. That was the last discussion, and we'll come to through that. And concomitant is something which is we had explained you last in detail. We may go into again if it is little confusing. He said he is still not able to grasp and apply it. So next we see that today's lecture we try to see. So Herring has developed this kind of 4 into his materia medica of the encyclopedia. He has given us this diagram. That is, his schema was the same, but this schema overall was 3 up to 3. 1, 2, 3 is Hahnemann. 4th one is also Hahnemann, because we decoded last is Aphorism 95. There he says it is the minute details of every case is very important, and those minute details can become concomitant. So this is the schema of Herring, and Herring says that even 3 out of these 4 is enough to get the result, or that can lead to a curative remedy, selection of curative remedy. Next one. So last time we gave the Aphorism 95, and after decoding that Aphorism 95, we gave the case of the Iridocyclitis, how that Iridocyclitis we have treated, and that was leading feature giving rise to, giving indication to select Rhus tox, and how Rhus tox was there. That I think we had photographs also we बताए थे last time, and the different cases of rheumatism we had. One is abdominal muscles, which was very rare. If I would not have understood that what is abdominal muscles, patient went for 2 different doctors to doctor. Even got operated because the inguinal pain for a hernia. But the pain remains same. In fact, he became like that. He walks like that only. And the remedy was very simple, Phytolacca. Now here, how to derive concomitant? Abdominal muscle. So materia medica also comes into the play. Always very tender, as if it is a guarding. He doesn't allow to touch to that muscles. And very chronic pain, continuous chronic pain on abdominal muscles. And that rheumatism has led to selection of Phytolacca, complete cure of the case. So if we can see the Rhus tox case last time, to recap. So now we see the 3rd case now. How to construct concomitant from therapeutic pocket book. That is Allen's TFLM's. TLM, therapeutic pocket book. It is derived from exactly ditto from Bonnie-Mason. How Bonnie-Mason has solved the query of concomitant. And he says that if you can make a concomitant, formation of concomitant, that will solve the whole case. And a very safe method of solving the very chronic cases. We'll see right now how do I come to the selection of very common remedy from very serious pathology. Next. Besides these common symptoms, the first one we'll go to again. So before that, this 3rd one. Yeah, next. Yeah, in all cases of rheumatism, because another case of rheumatism is going to come up now. In all cases of rheumatism, for instance, will present certain symptoms in common. The diagnostic symptom, that means the pain in joints, pain in muscles, swelling, pain in like abdominal muscles, as I said. So it is common to detect that it is a rheumatism. Now we have a group of the symptoms in group. Those days, only uric acid and rheumatoid. Now ankylosing. Ankylosing, post-chikungunya, a number of things are coming up. Next. Besides this common symptom, each case will present what Hahnemann calls uncommon peculiar characteristic symptom which represent the individual factor in the case. That we have to decide in every case. Let it be acute case coming to you, chronic tonsillitis recurrent, chronic pain in abdomen, chronic this and that, everywhere. So this you have to find out the peculiar symptom, uncommon and characteristics. Next. Symptoms which differentiate it from the other cases from its class. So it may be the rheumatism, per se, joint pain, muscle pain or whatever it is. These symptoms are vary in each case. Yeah. Next. The cases will start, we'll show this one slide. We'll start the video. Yeah. There's no more of the history is required. I'll say that how to see the sensation, what the patient is going through, and that sensation and that rheumatism, and how they are converted into, along with the modality, into concomitant. We'll see that. Whether my medicine is acting or not. Our topic today is after giving the remedy, whether our given remedy has started very tricky. The homeopathy works very dynamic and very minute dose. Dynamic and minute dose. In that small sensitivity, you have a small window to judge whether your medicine has started acting or not. So what has been said now? Dry skin. Location is fine. All muscles, joints. So you see the wasting. And how much is the pain? As if 50 kilo of pain. Unable to lift is started with that. Even right now, she is not able to do that. All muscles are so much painful. This muscle has gone into the dorsum has gone into wasting. It's like a tendon only that. And she has the wrist. So usually patient कैसे चढ़ता है अगर चढ़ेगा तो. Now what has happened with wrist? It is there. There is not much of swelling. But what she did? Elbows. Yeah. I had so many patients in past. I could not understand that remedy. But after approaching this approach, I started making the difference. And what was the concomitant? What you can see that pain? All. It's like a rheumatism. Everywhere. What is this slide said? No? That common diagnostic symptom. Rheumatism to hai. Now in that next slide, what do you have to come? Characteristics. वो ढूंढो वो मिल गया तो रेमेडी आ गया. You have to find out. ये माइंड में से नहीं आता. बहुत ज़्यादा it doesn't come through mind. Sometimes it doesn't come even from the chief complaint. In many of the cases, it comes from either modalities or it is the cause, like we were discussing, illness from death of somebody. Very close people, not love, affection में ज़्यादा आजकल नहीं आते. Yes, but this is something peculiar we have to see. So I have made if I read the materia medica, you will say साला अभी तक दिमाग नहीं चला हमारा. It was not happening. I remember long back Smita Patel, if you remember. अरे वो ऐसे ही चढ़ती थी. So I was treating, rather we were treating. Hahnemann says in footnote 77 that each and every individual case as considering a separate case. I was treating before 1816 as if every disease is a separate disease. And after finding what is the miasm, the fundamental cause, and the fundamental definition also we will try to find out. After finding out the fundamental cause, I am treating the base, only fundamental cause, the miasm. Seat of the disease. वो seat किधर है? Seat of the disease. In every patient you have to find out. Right? So now next. The second case we'll see. She is a 39-year-old and she was referred by one of the, what you can say, instructor who is giving the Pilates to her because of the too much of pain, and that is the usual physiotherapy they give. Female came with the complaint of rheumatic pains, but the HLB 27 was positive, and it was since 15 years. So she remained unmarried because of the pain and deformities. She could not. Because when you see the video bhi hoga sir, we'll see that. And she had taken multiple treatments for years, and even the immunosuppressants like SARS, methotrexate, everything has been done. And still she has developed deformance, wasting of muscles. The Rhus joint was mainly affected. Again here, Rhus joint was mainly affected, and she also complains of dry skin and callosity of feet. This is how it is. Now we'll see the video and then we start going to understand what is the seat of disease. Let's see. It was in between this was. She came somewhere before April she came. Next. So the dryness you can see that how slowly and nicely. See the callosity is clearing up slowly. velocity here. They said this, if you make the concomitant, your case is solved. So I showed you the how many patients you see that they are climbing with the support of the elbow. Even that 3 feet car, 30 inch car, this is the little longer. So she can climb on the stool, but she cannot climb on the table. She has to take the support of elbow. So what is most affected? Yes. Only one medicine we have, like Phytolacca, I showed you that. Now see that remedy batao. And with that remedy, all external signs are also disappearing. That means it is the remedy. Remedy is only one, and that is rheumatoid. Fantastic. And it is one, and before to that, I have treated 2 other cases just with Rheumatism perfoliatum. They having severe anemia. Now whether Rheumatism was right remedy or not, how to judge? Is it severe anemia, paleness, severe weakness, and every time she comes, she climbs with the same way, climbs with elbow, not with the wrist. And after the rheumatism, her fever started going down, the recurrent fever, recurrent taking leave from the job. She stopped taking painkillers, which she was taking ibuprofen or something other thing she was taking. 2-3 painkillers, SARS and the immunomodulators. Everything she stopped slowly, gradually. And then when she is coming now, she is totally head and hearty. Only deformity is little certain, which is stiffness which has remained. But now she is able to walk, climb on the table very easily. She is a teacher, having to make the correction of papers. She is able to do without any difficulty. Her fingers have become normal. When the anemia gets corrected, that is the time that you feel that your remedy is right. Why? What was the disease was? Autoimmune rheumatoid arthritis. So what happens is one of the morbidity or parallel complaints is depleted WBC formation and the hemoglobin coming down. And once your remedy is right, even in spite of she was taking earlier rheumatinib, it was not getting corrected. Now she is coming up, when anemia is improving, skin is becoming normal, and that paleness is gone. The life, as is the Hahnemann says, what is the first sign? The
color comes back.
no, the first time is liveliness. They become more cheerful. That is the time. That is everything is coming back, and that is because of rheumatism. And the remedy is repeated more often. At least 30 potency and then plussing, and I think she is on 200 now. So Bhatija, किसने लिया? Amitali? हाँ, तो इसने लिया था. Second was another lady. She is about 55-60. She was having sudden pain here and then cannot walk. Same. What is the rheumatism का description will go through. Same description. Cannot walk. The wrist काम नहीं करता. मैं अभी खलास हो गया मेरा. ये काम नहीं करता. Wrong. I always take care that it is wrist. It is not the base of thumb. Okay. They are very close. So I see the wrist, and sometimes the wrist is only this much. They cannot do it. Complete pronation, supination. They cannot do it. So this has to be done testing, whether they are able to do it, or whether you try to do this, and whether this is there or not. Tenderness. If tenderness is there too much, that means it is there having the affection of the wrist. Now the rheumatism is a remedy we'll try to. You understood now why and how the concomitant was made. अभी इसमें से वापस समझेगा. What is usually rheumatism used for? Fever. Now I have been using rheumatism very repeatedly for acute viral fever. Now even for dengue, malaria, chikungunya, everywhere there is rheumatism. Because what is the symptom that you will come to know? We have compiled from LS, that is one. Second is lippet, and third is the cloud. And to some extent, because the warning was both Farrington has not given in very great detail. I think let us see. Adapted to जरा बड़ा करें. You can make it larger. If everybody can read it, let me know. Is it okay?
Yes.
Okay. People of old age, worn out, inebriated with severe alcoholism. Worn out because of severe alcoholism, cachexia, after prolonged fever, bilious fever, bruised feeling, all over body as if broken, beaten, bone pains of affected part, the head, limbs and pain, all description. All description you say, and Eupatorium has it. We have not studied the Eupatorium in such detail because we were not finding it too applicable so much. And it is, the first line itself says that it's very defective anti-miasmatic remedy. First line suggests. It's not a superficial or only acute remedy. Let's see. And with my experience I say that it is very defective. Anti-miasmatic, why? Because the miasm में एक remedy दिया at the seat of the disease, every other complaint goes off. That is the, you saw this scheme which was improving that girl, anemia in other patients. So, bone pains, now it is otherwise known as bone set ka remedy. Wrist as if dislocated. Wherever the pain in the joint happens in Eupatorium, the pain as if it is dislocated. They can't use it. That is why they use elbows. What the point now? This is the differentiating feature of Eupatorium and other remedies. The differentiating feature is individuality factor, and individuality is concomitant. Pain so severe as if मेरा पैर 50-100 किलो का था. So severe as if they cannot twist and turn into the bed. So much stiffness. Their body is so heavy they cannot do anything. Yeah. As if bone is broken. Stiffness and soreness. That is the constant. Broken, that is fractured or dislocated, stiff and sore. Pain comes and goes very quickly. If you see the rubric, pain comes and goes very quickly. One of the remedies is Eupatorium, like belladonna. So other remedies, if you recollect, comes and goes very quickly. Yeah, magnesium she said one. That's it. Now restlessness with the pain. Bryonia has nearest analog with profuse perspiration, and the differentiation which this material gives is very quick. The Bryonia has profuse perspiration, Eupatorium has less of no perspiration, less of or no. And Eupatorium less. Go down. Swelling of feet with rheumatism, and this is I have missed in number of cases. I have a lot of swelling in the feet with rheumatism. So that happens usually in chikungunya. Swelling of feet with rheumatism. That is one of the remedy is Eupatorium perforatum. Swelling of feet. And you say patient is saying itna mota ho gaya. Acute. The great frustration and weakness with epidemic influenza, aching, soreness and illness. This is the remedy. With usually 1 day fever, and patient can say nothing is left in the body. So much frustration, so much weakness. With the acute viral fever, malarial fever, dengue, chikungunya, whatever is acute with as if there is no life left. So much weakness. Extreme. And with that weakness, they have a hoarseness, they have a severe headache, burning eyes, every symptom of the acute influenza fever, acute malarial fever, acute bilious fever, vomiting, nausea, everything is there in Eupatorium perforatum. Yes, cough, following measles, pulsatilla is one of the useful in malaria, influenza, dengue, chikungunya and viral fevers. Periodicity is one of the marked feature of the Eupatorium, everybody knows. Nausea, vomiting. Occurring in autumn and summer. What is that? अपने लिए बहुत काम करें. अभी summer, we have so many fevers which is coming, fever. What is the repetition I say to the patient? Every 1 hour. Next day they are fine. If you remember, the other patient also, other remedies Naxmos Chata. If you remember, the Chaudhary. I was asking him question, ऐसा like सुना ही नहीं, as if he could not analyze what is being asked to him. And that is Naxmos Chata. Because brain goes in, थोड़ा dull हो जाता है. Naxmos Chata. Dull, drowsy, and given one, the way he comes, you feel that as if इसको admit ही करना पड़ेगा. घर वाले बोल के ही भेजो, इसको admit करो. But he took a chance. बोला एक बार मिल के लेते हैं आपको. We gave him 1 hour. Next morning he was fine, and day after it was completely normal, as if nothing has happened. That is the quick action of the remedy, which is. So how to judge the remedy? वो अभी आते हैं काम पे. Muscle inflammation with fever. Other remedies. First is Eupatorium. So most what you can say, the location, sensation, modality and concomitant. Concomitant come from modalities. That is one. It is not the only complaint occurring in some other complaint and associated with only one definition. That is the problem with us. So if you read the TPB, it has clearly written you can make the concomitant as a modality as a concomitant, or sensation as a concomitant. So here we are making tissues, that is 4 जो था ना, again 4, yeah, go back. This 4 को, go back. This, any of these 3 can make concomitant. It may not be just concomitant somewhere into other system and associated and parallel in that. It's not that. If you read TPB, that is what I'm saying. The reading, and because of that TPB का ही मैंने वो निकाला था. Next slide. Next one. This is from how to construct concomitant. It is constructed from this book. Getting guidance from this book. As I said, I had a patient earlier also, but there was no concluded from that how to make concomitant. It was this, we make the concomitant like that. So one was ankylosing, one was pure rheumatic. And the third lady, which was first case, I gave the video only because to give you the clue that what kind of the rheumatism, as if this joint is dislocated. They can't use it. The sensation is as if dislocated. Now again to repeat again. So with migraine, they have ending into vomiting and relieved by headache. The ending into vomiting and the headache is relieved. So whenever there is a severe excruciating pain, severe weakness, you can think of it. Sluggishness of organs and functions. So that is come down. So there are 3 books which we have taken the reference is from Allen's, Lippe and Clark. And please do not believe in other materials which are so much more. Do not. Because this, unless you try to make the concomitant, that is why Eupatorium ka another look. And we see the other cases. Can we go to the theory again now? What is the further? It is not theory but the practical hint which is here. Next. Yeah. Aphorism 200. You can start. First day. So when you give the remedy, what to expect? Number 1. Homeopathy is very difficult because it's a very minute, very small doses, dynamic doses. How to pick up that your remedy started working or not. So you can start, read loudly. Last time I think I have given you as a lesson. ये पढ़ के आओ तो पता रहेगा. Yeah.
Had it still been present to guide the internal treatment, the homeopathic remedy for the whole disease might have been discovered.
Just slowly. So what is that present?
Had it
Local
still been
affections.
present to guide the
Local affections. Okay, so you show me that every time I take the local, it will be skin, that will be anything else.
external signs.
External signs, mein one of the sign is
Skin.
skin. Yes, remedy, the homeopathic remedy.
remedy for the whole disease might have been discovered. And had that been found, the persistence of the local affection.
So that means if you find a right remedy. Had that been means?
Had
If
that
you
been
find a
found,
exact
right
remedy, yes.
The persistence of the local affection during its internal employment would have shown that the cure was not yet completed.
Yes, that means so that lady, the young girl with 39 years with ankylosing, I was trying to show you the eruptions on face. It was not so very clear, but now we see that at least from the cons you can see. It's not going to disappear suddenly, but slowly start. Why the callosity has come, if you remember, in her case at least. If you can show her the pictures again. Read it again. You'll realize that what is I'm trying to show and what is the homeopathic examination in each and every case, where to see. Yeah.
Had it still been present to guide the internal treatment, the homeopathic remedy for the whole disease might have been discovered. And had that been found, the persistence of the local affection during its internal employment would have shown that the cure was not yet complete.
Yes, cure is not complete because that callosity, though it is slowly regressing, that shows that is number 1. कि homeopathic remedy ठीक काम कर रहा है. If not touch, वो हिला ही नहीं, callosity remains same, and this inflammation on the skin remains same. I am not on the right remedy. क्या लिखा? Guide to
Internal treatment.
very simple. He has given follow-up so clearly. 200. More you read, more you realize that how to follow this animal properly. That's a guide to internal. So my guide is the local signs, not just the. Forget about it. Now once this is normal, now the pain in her, we don't have the video now. pain in her, the whole of the ankylosing was the same, as if dislocated. So that dislocated feeling and the rheumatism, that gives the selection of Jupiterian perforator. Now if any patients coming to you with the dislocation of wrist without fail, it is only remedy. And because it is not a specific remedy.
Yeah.
Somebody will say, तो Allen's keynote है. Specific हो गया, but not. We have explanation for that. That is aphorism 80, footnote 77, 103 and 205. Everything where Hahnemann has written very clearly, they are not specific. We have individualized remedy or the characteristics or a particular differing features we have found out. As if bone is broken, as if the joints are dislocated, so much severe pain. And in that the wrist is most affected. In Phytolacca, most affected is abdominal muscles. Exactly. No remedy as abdominal muscle ka remedy. And this is peculiarity, not a single or specific remedy. Now, yes, next.
But were it cured on its seat, this would be a convincing proof that the disease was completely eradicated.
But where is the seat?
So,
Seat. The sora. Where is the sora? The seat किधर से लाएगा? ये सीट को ढूंढते ढूंढते मेरे को 3 से 5 साल गए. ये सीट किधर भी मिला ही नहीं. How to see the where is the seat? Seat of the disease. Yes. You say rheumatoid arthritis, for example, autoimmune disease, for example. It's an autoimmune disease. अगर acute viral fever आया, malaria, that is the per se disease. He said that previous to the slide, all rheumatism pains indicate this is a rheumatic pains. But then there is a bifurcation, uric acid का, RA का, ankylosing, सब आते हैं अलग अलग. Fine. In that you have to find out what is the peculiarity. That is our diagnosis. Our remedy comes from that. But ये seat किधर है? I want to understand where is the seat. Because see, as we were discussing, we are not said the aphorism कभी पढ़ा ही नहीं था. पहली बात ये होता. Aphorism, how to take follow up, किधर भी नहीं पढ़ा गया. It is our duty to learn further. टीचर लोग ने जितना पढ़ाया, मार्क दे दिया, पास कर दिया, बहुत हो गया, उनका काम खत्म. It is our duty to see that. How to see that? Now it is that seat. Yeah, यही सब. Seat is where is the fundamental. All fundamental cause is the seat. Now where is the fundamental cause? How that comes? Where to attack? How to see that? Where it cured in its seat. Suppose you have given a remedy. Suppose I have given the Jupiterian perforator. This,
this would be a convincing proof that the disease was completely eradicated and the desired recovery from the entire disease was fully accomplished. An inestimable, indispensable advantage to reach a perfect cure.
Perfect cure. This man is writing. Have you heard? Kabhi kidhar perfect cure. He is writing. If you want to achieve this perfect cure, you have to follow this. Go back again. And ये बात ये 200 and how to see that. Now this guide to internal treatment, external क्या क्या मिल सकता है on examination. Like as you said, clinical examination, you see the GIT, you see that externally all over the systems, lymph node, the joints, the skin and everything, and auscultation, ears and everything you see it, right? And that is the guide to internal treatment, the internal treatment. And even if you clinically throughout देखेंगे, for example, the biochemistry and the all investigations are also the same thing. Suppose we had been treating a girl of 12 or 13 years, severe dysmenorrhea, left-sided, huge the ovary, it was very big size, 3 inch or 4 inch. So the morning we had the sonography report. Yeah. That was 3 months back, and very much concerned because 2 दिन सो के ही रहती है. I said ऐसा होता ही नहीं है, 12 साल की लड़की को क्या इतना पेन होता है? He said very probably endometriosis has developed in that area. And then the second sonography was taken. He says the left ovary is clear. That's fine. Your internal sign, external sora and everything is getting clear. Whatever remedy you have given, even if your pathological report comes, structural report comes true, patients are very much happy. I want to see that my skin is getting normal, clear, no scratching marks, no dryness. Is it? No oozing, no this, that. Everybody wants to see some proof that your remedy is working. We have to find the proof. Before the patient comes to know, we want to understand that proof is there. How that lady with anemia and rheumatism knows that this medicine is working on her? She is concerned with her anemia, weakness, pain. But as a doctor, we must see that what is improving. Now if she goes to anything, now RA test may be 500, 600, sometimes 20 or 30. Sometimes RA test is 5 and 10. But the patient is having pain and swelling. There are pain ki tarah. So they are concerned with whatever is left. And that is the external signs. Laboratory may give you. But in this structural change, whenever you find, see that is recovering. So can we have that external signs? So from where these external signs has come up? Yeah, come on. So where these external signs? PPT is better. Short में बहुत कुछ हो जाएगा. So where this inflammation comes from? Yeah. So where is the disease? Seed. Question is that. The problem is that Hahnemann has written in his own whatever. So every time patient comes and whatever inflammation is left, that you have to keep on watching that inflammation often and often. Fistula में आ गया, for example, per rectum. So every time to see that whether fistula's opening is there, discharge is coming at or not. Suppose, so this we have kept it, that is ingrowing toenail. Even this is left and you say that everything is improving, this is not improving, that is the time to reconsider the medicine. If it has stopped, in spite of doing repetition, in spite of going for plussing, changing the potency, not, then you have to change, because that miasm is still at the seat. And this may be appearing as a chronic sign, but that inflammation is still going on. How to judge? That excoriation is still happening. Lignified, but it is still there. That the behind the ears, you have to always see that. Next, see that nails so much distorted, so much next, so much dry, this much. Patient, they may be saying that I am right, I am okay, but I am not okay. When I see that this is there still. Because this is there, this is the guide to internal treatment, that okay, everything is quiet. It's a latent stage or a dormant stage or a quiet state, but then it may flare up anytime. And once it flares up second time, it will be more fulminant, more severe, more dangerous. So constant like that, itching. See that chronic inflammation here again, itching, thickening, nails are distorted. Next, this is something which is most important. I always see put the eyelid down and see that if they are itching too much, it will be a muddy, very dark color. If they usually, and then first visit I say that इसको तो आँख में भी खुजली बता रहे, आप भूल गया हम तो आँख में बहुत खुजला था, जब देखो तो उंगली इधर रहता है इसका. So that has to go, this inflammation has to go. This constant peeling of lips, again the paronychia, redness, congestion. Yeah. So to achieve a perfect cure, what we have to do is, dyschromia. On the skin, what you see is several illness which is persistent, and they may take it as a usual and normal thing, which is not. Mucosal thickening, callosity anywhere, palm, soles, knuckles, fissures, toes, persistent itching, on and off, though it may be very trivial. Cracks, chapping is also a sign of chronic inflammation. Then hardening, callosities, lignification, we saw the photographs. Then mucosal erythema anywhere. This was that girl was having erythema all over face. Chronic fistulas opening, fistula anywhere, anus, dental, wound, Bartholin cyst persistent, chronic infection, ringworm, tinea, persistent pathological discharge anywhere from the body indicates that it is still going on. And after giving remedy, if they get disappear, that is something great. Very commonly seen on the scalp. Where to see? Now, where I see in every patient. That is what I do. On scalp, I see whether seborrhea is there, scaly dandruff, dermatitis, severe hair fall, alopecia patchy, which we saw, and itching. Ears, always to see inside. Itching in external and auditory canal, very common. For scaly, you can see the scales here before and persistent discharge, cracks behind the ear, dryness behind the ear. Eyes में muddy sclera, dryness, poor secretion of the tear again is a big problem. Itching and pallor of conjunctiva, anemia, pallor, That is also a sign. Nose, crack at the nasal aperture, callosity like growth. And here you can see that many people has that because of the chronic inflammation, it becomes thick, black. Dark pigmentation at the nasal floor, very common it is seen. Persistent nose block, nasal polypi. Again, face पे आ गया, thickening, itching, angular stomatitis. मैं आधे तो फोटो नहीं है इसमें, it was there. Angular stomatitis and large number of photographs were there. Cracks at the center of lip, ulcer on lip, mouth, recurrent stomatitis, gingivitis, pyorrhea, halitosis, severely mapton. And I've seen that after giving this simillimum, whenever we find anti-miasmatic, the mapton becomes normal term. The epithelium gets regenerated and the cracks and fissures also healed up. Chronic and unusual dryness of mouth. So that leads to one of the autoimmune disorder nowadays, very common. Sjogren's disease. Neck, pathological or persistent enlarged thyroid gland. Even if it is euthyroid, benign enlargement is also, even if it is euthyroid. Thick dark band in the skin, axilla, tinea, furunculosis, itching, groins, itching, lesions, tinea, dermatitis, nails, peronecia dry, general, scanty or poor natural discharge, excess discharge, offensive discharge, dysmenorrhea, peroneia, in the hormonally active females. Also a sign that less of discharge mucus into the vagina, less discharge anywhere, eyes, ears, mouth, it's again like that. Yes, again another point to find out is the physical generals for the patients, whether your remedy is active or not. If there is a constipation has come up or multiple times they are visiting for the passing stools, they become normal. And if it is constipation, it gets relieved. Unusual frequency at night, which is not a pathological like prostate or cystosine, but they get cleared. They get proper sleep, they get proper appetite. Appetite better in morning, afternoon, whenever it is a time. So these things are improving. Physical generals is meant for that, to judge whether your remedy started acting or not. If that improves, that means what improving is? That physiology is improving. That physiology is improving. Here the external signs, that is also again then a signs which to be noted on the first visit. And photo will lena. And then keep that photo as a record and see that whether, refer it every time whether you see the patient. And you can put it to the patient also, ये पहले ऐसा था ऐसा था. That is more convincing than rather you giving them remedy and making them understand that. Yes, कुछ तो positive हो रहा है. So these are the positive signs. Yeah, next. So now again, where is the seat? Because without understanding the seat, ये perfect cure कभी नहीं आएगा. That's the problem. Clue is, if you want to achieve a perfect cure, the seat has to be understood. So what happens in homeopathy? The disease enters into the body. It's also dynamic. There is no system, the region known as KSA, not like bacteria or microbe theory. Is that it? We don't have that microbe theory. So they forget about that. We have that. Hahnemann has given the lifestyle is a disease, this is. But if you remove those lifestyle ka factor, patient will be normal. So chronic miasmatic disease, uska seat ढूंढना है. So this is from where the disease enters in. Disease develops, and if you give the remedy, then what has to happen? The how it has evolved, it will get out of the system. Right? Very simple. So आके जिधर बैठा है उसको ढूंढना है. So where it has entered in and where it is there. So now we start with that. Thanks, but I'm still going to talk it more because जितना भी बार बोलता हूँ तो आधा वापस recollect होता है. Otherwise it doesn't. So today is the seat of the disease. The main aim is to understand seat of the disease. Origin of the disease has to be understood. How it has been said ample number of times, and that is clearly speaking 3 places where it has written. Aphorism 80. You can think. That is number 2, page number 33 of chronic diseases. And number 3, it is chronic diseases chapter Sora. 3 places it is clearly written that how the disease evolves into the human body. And wherever it evolves and settles down is the seat. And if you dis-seat or if you uproot the disease, all the pictures which are coming up, the symptoms which are coming out of the disease will be taken away. Now our point was in that girl who was not treating the callosity. But to understand that effect of our remedy, whether our remedy started acting or not, we are keeping watch on that. We are keeping watch on the external signs of dryness of the skin. That is a guide to internal treatment. Now how the disease originates, how the disease attacks us, that is what, and how it propagates and furthers all through the life. He explains how the first time the disease happens, how it settles into the body, how it evolves and then keep on recurring. That is what he has explained here. Yeah. The time of infection. It takes place in a single moment most favorable for infection to occur, and the infection occurs from its first contact through skin. Whichever the disease happens, it is psoriasis or syphilis. Everything happens through skin. Right? Next. The period of time of during which the whole organism is penetrated is by this infection. Unless it gets inside the skin, it cannot develop. Got it? Infection until it has developed within completely, internal development, पूरा system में आ गया. Then the example given is like measles, chicken pox, smallpox. Once the virus comes into the body, either through epithelium or the lining of the mucus, it enters into the body and then it has a prodrome. So unless it is developed completely into the body, it doesn't get evolved and erupt out. It may abort. Fine. So unless the internal treatment development is done, and the third stage after the infusion and development, infusion is there, internal development, infection, it touches the skin, it remains local. Once it is inside, it is local thing. It is all uniform all through the body. Now how it travels, because once it is inside, suppose if it's a syphilis, contact with the psychotic or the gonorrhea patients, it doesn't mean that by chopping off that part, it will not enter into the body. The moment it enters, it goes through the whole of the system. This is also explained by the immune system of the body. Whenever there is a small infection, the whole immune system comes into the picture and that nullifies. If it doesn't, it goes to the whole body. But the honeyman has little different explanation. It travels through nerves, then communicates in an invisible dynamic manner that he could not explain, and he said that nobody will be coming to know, but modern science has found out some ways. The nerves, the whole body, this shows the disease as the whole body and in all directions. So everywhere all tissues are affected now. The disease here is complete. Internal development is done. The modern terminology, it is incubation period. Here is the seat of the disease. It is all over the body. Before evolution, it engulfs all over. Fine? I'll tell you the further how it comes. Third stage is the outbreak. Internally it is developed, well developed, then whenever there is a chance, disease comes out. Internal development is done, and it is the defense system, that is the vital system, whatever it tries to soothe the internal malady by establishing a local symptom. First it comes on skin. That is what is external manifestation of internal sora. That is 200 में same बताता है. This eruption signs acts as a substitute of internal malady. Third, signs and symptom of the first time breakout is known as the primary symptom. I was still searching. Even this was a very clue-like. It's like a puzzle which I had to solve. Primary symptom क्या होता है? First symptom. So that may be in the first trial में सबका primary आता है या skin पे. So which type? Now why certain remedy in first? How to take primary? That's some other time. But see today which is a seat. Then thereafter. They keep the miasm confined, covered, slumbered. For long number of years it may remain quiet, or it may erupt. It as also bronchitis, eczema and everything. And this, next again. After the infusion, the disease spreads into the whole body, into the full developed sign. Single infusion may take. The foundation of all the future miasmatic disease is here, the seat of the disease. Foundation of all the diseases. Now if you attack with eupatorium, a right remedy, anti-miasmatic remedy, which will remove the inflammation at all the levels. Miasm is nothing but what? It is the inflammation. Every disease has a base as an inflammation. Autoimmune, whether it is genetic, whatever you call it, they starts as an inflammation only. So this is the seat of the disease. Now here we say that eupatorium till the time it is able to remove the external signs, the signs of the patient. It may not be patient is not going to open up completely. She has only a few millimeters, maybe 2 or 3. She has to take the stool and suck only liquids. She cannot chew it. So that is the situation she has. That is why there is a vesting of the left side of the face. And that is why. Now I have a video, I think recent video भी है, आदमी भी है शायद इसमें है न चाहिए वीडियो देख बताओ इसमें आएगा तो ही आएगा इसमें yeah but then it should come here only then it is fine that how I elicited the eupatorium and that was it fine. So seat is here. Seat is once the infection comes into the body, it spreads all over and then it erupts. So before the eruption, the seat is already there. And it is from there, it is recurrently happening. The same story repeats and repeats and repeats. I think next slide is that. Same story. Now external signs, I was saying that one of the external signs is adenoids, lymphoid tissues. I want to see a few cases if you can have. Internal treatment, that is the external signs of psora. Wherever the psora attacks you the first and it is shown out on the skin first, but then slowly the pathology may come up. For example, you have a pneumonia case. How to understand? To take the X-ray first, second, third, the intensity of cough, whatever the general signs of weakness and other things has to go off. And that is how the pneumonia. And if it is persistent bronchitis, then again the type of cough, the amelioration, same again modality देखो, sensation देखो, location में कुछ रहा कि नहीं वो देख लेगा. Same thing again. What has happened inside? The same way it has to go out. Now whether the when you give the remedy, what is the time frame that you expect that it should act? It should have acted. Will your remedy started acting or not? So in a few hours or maybe if immediate is in acute. But even in chronic, he says if your remedy is right, in 7 days, 10 days, they see that everything is happening, is coming around. And something else, external, the infection, then the flare-up. The signs of the flare-up. Signs of the flare-up can be biochemistry, can be tissues, what you see, and the most, very simple, without aid of anybody, is the external signs of psora. So the adenoids are one, which I was saying to that. The torticollis, because of that. Spine is very tight, all sclerosed, even jaw is gone. This started having little movement after the eupatorium. One palate, it is there, and that's the small narrow passage, and the last one. નથી આવ્યું અહીંયા પણ that is first one. અત્યારનું છે last one. See the passage which is becoming wider, and the child has stopped having the snoring and easily breathing, along with the external signs going down and down. This is how this external, the latest one, which was not there at the earlier time, that is radiation. The photograph has come much later, but we have even in our repertoire in the books that adenoids are there. This is how the internal and the external both changes are coming parallel.